Hi, Shell Point. My name is Christy Skinner, and I'm the Senior Director of Healthcare. And I am joined today by Dr. Gary Goforth, your Medical Director, and Janine Hammond, the Manager for Case Management. And we are so excited to be talking to you today about the upcoming Healthcare Forum, Healthy Living 2019 and Beyond. We have 2 sessions, 3 different times that we're going to be offering you. One is going to be January 23rd, 10:15 at the Village Church. And the other session is going to be held at the Grand Cypress Room on January 30th. The 2 times are going to be 10 a.m. and 12 noon. So I'm very curious to know, you are going to be 2 of the team members that are going to be joining me for the forum. And we're going to be introducing a lot of new things to you in the Shell Point community. Janine, I'll start with you because you're part of what welcomes our residents in the very beginning of spectrum of services at Shell Point. And so you get to welcome our new residents when they're first coming in, sometimes a little overwhelmed, trying to navigate all the different paths of healthcare here at the community. And you are one of the departments that's always a hot topic because the residents are managed in assisted living by 24-hour care, they're managed in the pavilion by 24-hour care, but a lot of times in independent living is where sometimes they have the most needs. So tell me a little bit about what you are going to be talking about at the Healthcare Forum and some of the exciting changes that are going to be happening within your department.
Absolutely. Thank you, Christy. I'm excited to be here to talk about some of the exciting things that we have going on. And can't wait to reveal some more details in January at the forum. But I've been working hard over the past couple months with the green light to go ahead with some changes for our department. So we have heard over the years many requests and ideas about what the case management team here at Shell Point could do a little differently and what would improve situations a bit more and our interactions with the residents. And we've heard those requests. We have taken all of that under advisement and we have taken some action on that. So we've been very busy putting together a plan for what that's going to look like. And I'm excited to reveal a little bit more about what that's going to look like.
I think for your department alone, people are going to be lined up at the door to hear what you have to say. I know that over 14 years, you've seen a lot of changes to the campus and a lot of growth to the campus. So obviously the needs for support have changed. When we're going to have the panel there, we're going to have CJ join us from Connected Living. And I think that the exciting part about Connected Living is that she services not only Connected Living in the AL environment and in the pavilion, but she's going to be talking about what it looks like from a preclinical standpoint and how we can better service and provide educational opportunities for our residents in the independent living. I think one of the biggest things that we hear on campus is that fear of, what does it look like when I am starting to forget things that I used to remember? Where are my keys? How did I remember that I set something here and I can't remember where I put it? And the fear of just the diagnosis of Alzheimer's and dementia is prevalent. And I'm sure that you hear that all the time, Dr. Goforth, in the clinic. So talk to us about some of those opportunities that you're going to bring our residents from a preclinical diagnosis opportunity from your perspective.
Yes, well, Christy, thank you so much for giving me a chance to address this. I have thoroughly enjoyed my time here at Shell Point since July 1st, and we've already made several changes. But just in terms of how we want to care for our residents, we really want to emphasize prevention, trying to keep people as healthy as long as possible so they can enjoy their time here at Shell Point. We are blessed with wonderful resources in terms of the issue of dementia and Alzheimer's disease. We have a great psychology department. We have clinicians that are skilled in that. And so we are constantly looking at patients to see who is at risk, who needs further testing, when does intervention need to be done. And so that's happening now. We hope it'll happen even more as the new year starts. We're also starting some new initiatives. We've got a medical learning series that starts the second Thursday in January. That'll be conducted each month where we talk about topics related to wellness, common conditions we see, and so we're excited about that initiative. We've also got some new things where we try to get our Shell Point residents interacting more with our medical staff here. And I talked last week about Walk with the Docs. That'll start on the second Friday in January, and that'll be every week, where residents have a chance to interact closely with our providers, our physicians, our nurse practitioners here. They can ask questions, talk about anything they like, and I hope that that interaction will help us in our quest to make people just as healthy as possible here.
I think that's excellent. I know that one of the largest reasons that a resident chooses to come to Shell Point is because of the bandwidth of services, especially from our physicians. I know that that gives them great peace of mind in knowing that whatever journey they go through and whatever they're choosing to navigate in the continuity of care, that they have that support from a clinical standpoint, and you're going to walk with them every step of the way. So as we continue to support them, continue to get to know them on a deeper relational level, they're going to feel even more comfortable to have those difficult conversations of, you know, I've forgotten something, or I can't remember like I used to, and that's an intimidating conversation to have because it's nothing that we want to face. But if we feel like we have that deeper relationship with you, it's really going to break down those barriers to have those difficult conversations. And I think that what we're hoping to accomplish with the Healthcare Forum is to really allow our residents to know that we are here from the very first step on campus all the way through the continuity of care that we offer here at Shell Point. So in saying all of that, we hope that you join us at our healthcare forums. Once again, they're on January 23rd and January 30th. And we are so excited to be able to introduce to you myself as the new senior director here at Shell Point, and also the extensive talent that we have in our leadership team. So you will meet every healthcare director that we have on campus, and they'll be able to highlight 2018 and all of the accomplishments that they've made and all of the changes and innovations that we're bringing to you, and also the vision casting for 2019 and beyond. So please join us. Janine, Dr. Goforth, and myself, thank you for your time, and we look forward to seeing you at the Healthcare Forum.